Honest, sorry, if you work for a periodontist, typically that periodontist gets the patients referred to him by either a prosthodontist or a general dentist. So you don't have a lot of room to refer there. There are times when the patient doesn't have any doctors, and the periodontist typically prefers to work with a prosthodontist because it's just easier for the periodontist to work with somebody that can guide them and can, you know, give them a better surgical guide and whatever, and do a job that, you know, two of the things in prosthetic dentistry that you should know, and I'm going to talk about this at the end, is that the two most important things for a prosthesis of any kind, from your point of view, is that has to be cleansable, one, and second one, the distribution of forces have to be such that it doesn't affect the periodontum. And so those two things are what you will be looking for. And so I guess another reason to refer to a prosthodontist is you see a prosthesis that isn't cleansable. And so that's a problem, obviously. Most periodontists, going back to if you're working for a periodontist, have relationships with either a prosthodontist or a general dentist that does a lot of work. So typically they want to refer to that person. So it all depends, again, who you're working for and so forth. Anything else that a dental hygienist should know about your specialty? So that's where I was going to say that the cleansability of a prosthesis. It's probably very important. Most prostheses are made by lab technicians. I guess I didn't mention that, but that's another difference between a general dentist and ourselves. We have to, through a resident, we have to make our own lab work. So for example, we have to learn how to stack porcelain, how to bake it, how to do all that, how to cast metals, how to process dentures and whatever. So that's not the same as to just simply send this case to a lab. And so lab technicians, they are just a technician. They don't know anything about biology. You know a whole lot more about biology than a technician. In Oregon, there used to be a program for technicians that was very good, that was closed years ago. There was just no good education for technicians anymore. The best technicians in the United States are from elsewhere. There is just not good dental technician education in the US, with a couple of exceptions. And so unfortunately with that, especially in the era of we do everything with computers, you do get a lot of prostheses and crowns and things like that that are really not cleansable. And that's because the technician doesn't know how. And so that is something important that you want to check out. What is a cleansable crown? You know, especially call it a crown with the furcation involvement type 3. How you should design that crown. I guarantee you that if you post that question in a room of 10 general dentists, 2 know the answer. If you put that question in a room of 10 lab technicians, none know the answer. And so that's something that's important. And that's even worse with implants, because especially fixed restorations that are in fashion, they are not very cleansable. You really have to know how to make them so they're cleansable. And you working as a hygienist in something like a fixed hybrid is not fun, because it's hard to clean. And the patient lost the teeth because they didn't clean. And so cleansability, it's important. And the second one goes back to occlusion and the distribution of forces. I'm not claiming here that malocclusion will cause periodontal disease. We all know that bacteria has to be there. But if you have a tooth that has mobility and already has bone loss and has some bacteria, and then you add to it a premature contact on that tooth or a heavier contact on that tooth, well, that's going to go faster than the one that has no occlusion. And so I guess in the hands of a prosthodontist, we check on fremitus and we change some things like that, and we try to make sure the occlusion is stable, and that it's important, and you should look at that as well. And so that would be something that I think those two things are the way in that a prosthodontist is strongly linked, I guess, to maintaining teeth, and periodontitis and things like that. So I think those are all the questions. Do you have any questions?
I'm going to give them a minute here to see if the students have any questions. And if not, I have a couple.
Okay.
Anyone typing in the chat? Oh, it looks like there's, do you
I got
employ
it.
a hygienist?
Some do. I had a hygienist I began, I guess I didn't, I work in Beaverton. I've been open since 2002. And it's a very small practice. I used to have a hygienist. When I bought the practice, there was a hygienist, and I had a hygienist there until a little before COVID. I would say a year before COVID. For a while, I did not. There are prosthodontists that work as kind of work as a general dentistry, meaning they have a general practice and they do their prosthodontist as well. This is sometimes it's the only way they can make it. Working only exclusively as a prosthodontist nowadays with the culture I described is difficult. And so that type of prosthodontist will have a hygienist. And it will be basically an advanced general practice. The prosthodontists like myself, some of them do, some of them don't. It's problematic. I'll tell you my specific case is problematic because it's difficult for me. Well, first of all, most hygienists wants a full-time job because everybody has a family and they have to make a living. And it's sometimes hard for a prosthodontist because, for example, my office is too small. I don't have the number of patients to give a hygienist a full-time job. That means that then maintaining the same hygienist in the office can be difficult. And so clearly it's harder because of that. And then in my case, worse because, as I said, my patients have most of them have pretty high IQ. There's not much hygiene to do other than maintaining. And the number of patients, it's small. It did not make sense to me to have a hygienist in place, and especially did not make sense. Well, also, let's say I said, which happens to me for a while, is that if I only offer a day or two, it was too little. But if I added one day, then the hygienist was basically doing nothing. And that was a bit of a problem. And then the third one is this is a controversial topic. In fact, just last week, one of these hygienists that worked for me for about 8 years, and we were just on vacation with my wife and her and her husband, and we argue about this. But the hourly rate at which a lot of hygienists are operating nowadays does not reconcile financially with what the insurance company pays. When you look at that hourly rate and you look at what the dentist has to spend and all that, it's just financially for the dentist doesn't make sense. And I think it's a problem that you guys as a profession are going to face at some point. But at this point, if you are a general dentist, that doesn't matter. Because the role of the hygienist is not as much to make money in a cleaning session, but to find, don't get me wrong, I'm not saying this in a cynical way, but it's to help find more work on those patients to there, oh, look, you have a cavity here, you need a crown. So all of a sudden, the production of that hourly, and I'm talking here strictly business, the production of that hourly rate, of that hourly rate is fine, because you didn't produce just the cleaning and the X-rays. You also produce in the indirect way that crown, and that is something that for you ethically can be an issue, because there's always a black sheep in all things in the world, right? And dentistry is also one of them. There is also going to be the 1% dentists that are going to try to push you to find stuff, and so you're going to have to be ready to quit. Of course, these are the very exceptions. So that's tough for a prosthodontist, because a prosthodontist typically have done the work and have done that work to last. And so we're not fishing for new work. All we want is to make sure this thing is maintained. And so we don't have that element of that large general practice in where you're going to find a lot of work, right? The production of a general practice in the hygiene chair is very, very large. The production of the hygiene chair in a prosthodontist is very small. It's just a service to the patient. That's really all it is. And so, yes, you can have a prosthodontist that employs. Not all of them do.
Do you have any other questions for Dr. Ambard? Oh, in the chat, is there another one?
I don't see it.
Oh, no, there's that. That was still Charles or Trey.
I am one of the, I think there are 3 prosthodontists, including myself, who have an in-house lab. All the other ones send cases out to a commercial lab. And I'm on those who have an in-house lab. Maybe the lab only does some amount of work, not all of it. In my office, about 60% of the work is done either by a technician that I have there or by myself. My practice is quite unique because it's very small. I am heavily involved in arts, in guitar playing, and in writing, and so my practice is really unique in that sense. No other prosthodontist does lab work by him or herself. I think I'm the only one. But a couple more, one of them is my friend, so I know for a fact, has an in-house lab and do some of the work. The problem with having an in-house lab is that they know you're a prosthodontist and they get out of school, and the education of lab technicians is horrible, so they come and use you as the school. And so they stay there for a year or two, and then they go and open their shop. And so for us, it's just tough, and that's why it's just not very practical. I changed that model years ago, and so I basically, instead of hiring them and paying them a salary, I created a space where I said, here's this space, you have everything you need here, and what you're getting is you're getting my work guarantee. I'm going to send the cases to you, but you also can go ahead and send cases to someone else. In exchange, you pay a small amount of rent and you charge me maybe 10% less, and my case are always go first, or something like that. And that's how it worked for me. But it's expensive to have an in-house lab, whether you do it yourself or not. It costs more. The production of lab work, when you look at commercial labs, it's mostly by computer. It's almost like a factory line, and it's not very hands-on. Now, you look at crown in my office, and it's pretty much the entire crown is made by hand. Unless there is a core made in computer, versus in a commercial lab, the entire block is done by a computer. They just paint it and that's out. So it's a different level of dentistry, basically. The parts where you can't do it at your office are things that have to be printed by a 3D printer, or sometimes things that are metals that have to be worked that are hard, like titanium is pretty hard. Chromium cobalt, you have to have a massive amount of space to work with chromium cobalt. So those are the things that we don't do. We do things that are with wax, things that have to do with plastic or polymers and things like that, and things that have to do with gold, and things that have to do with porcelain.
Okay, well, I did want to ask you quickly if you get contacted by physicians very much. Do you ever do prosthesis that are in and around the oral cavity that you might get a case from a physician, or is that not?
I do because of my maxillofacial status, and I guess I didn't tell you this. I'll try to be quick. I know we are there, but maxillofacial prosthodontics, we do temporomandibular disorders, and we do appliances for sleep apnea. So that, I think sleep apnea is one that a hygienist could be looking at. Obese patients that clearly have problem breathing, that you say, you cannot see anything behind, and things like that. So we do get a lot of referrals from physicians from that. And also we get referral for physicians that are ENT surgeons or plastic surgeons or head and neck cancer surgeons, that again, there is a patient that has head and neck cancer issues and they will refer the patient to me. I'm the only maxillofacial prosthodontist in the metro area. So I do get a lot. So yes.
Interesting. Thank you so much for sharing all that information. I think we are at time. So unless there's someone dying, ask something. But yeah, we appreciate it so much. I hope you have a wonderful rest of the day. And can we just give thank you?
Thank you.
Thank you so much, Dr. Ambard.
Thank you. Have a wonderful day.
Thank you so much. Take care.
Bye.